of you. I'm humbled.
Yeah, really. Madam, we will start now.
Please, please.
Yeah. Otherwise,
Yes.
by the time they will be joining.
Wonderful.
Yeah. No?
Yes, ma'am.
Yeah.
Can I?
Yeah, start.
Ma'am, am I audible?
Yes, clear.
Am I clear voice?
Yes, clear.
Yes. If four things are followed, having a great aim, acquiring knowledge, hard work, and perseverance, anything can be achieved. APJ Abdul Kalam. This is me, Mrs. Vandana, first year MSc student of Shubdeep Nursing College. I wish a cool and sweet good morning to everyone. Our respected, charming, kind-hearted, abundant knowledge, huge educational experience with great achievement, who got success in their real life. Dr. Subesh Khanna, retired professor emeritus from prestigious Space City, US. This is my gratitude. Hearty welcome to international webinar on cultural concept nursing care. We are so glad to welcome you.
Thank you. Namaskar. Greetings from USA, New York, and I'm here and presenting for Shub College and Honorable this Dr. Varghese has invited me, and I am honored to be on this platform.
Madam,
Today's topic is our culture.
Ma'am, introduction. Sorry. Yeah. Respected Director Sir, Mr. Girish Goswami, and our Honorable Principal Ma'am, Dr. Achama Varghese Ma'am, would like to welcome all to this auspicious moment. Please, the principal, the teachers, and all friends from other institutions, I would like to extend my welcome to you all. Together, respect all faculties of Shubdeep Nursing College, would like to welcome you all, and I welcome all our lovable students to this international webinar, enhance their knowledge more. Welcome all. Now, this is our pleasure to introduce our chief guest. I request our proud principal to give a fabulous introduction. Please proceed, ma'am. Thank you.
Thank you, Mrs. Vandana. Good morning to all. Our warm greetings to respected dignitaries, invited principals and teachers of different colleges, online viewers of nursing colleges, and dear students. On behalf of Director Mukesh Giri Goswami, Mr. Om Giri Goswami, on the pleasant morning, I welcome you all for attending today's webinar hosted by Shubdeep College of Nursing on the topic Transcultural Concepts in Care. Today, for the international webinar, our towering personality, renowned and a pioneer of our nursing profession, Dr. Suresh Khanna, retired professor emeritus from prestigious Space University, New York, USA, and United Nations, ex-representative of TNAI at the United Nations, seed giver of Nursing Honor Society, India, and Clinical Nursing Society. Today, we institution are pleased to welcome you, madam, for accepting to share your expert view about through this webinar platform. We all know that the importance of diverse cultural knowledge for a nurse is very important for the safe, thoughtful, and ethical care of individuals, families, groups, and communities for diverse backgrounds. Today's expert is having vast experience in this regard. Madam, we all are honored by your presence on this occasion. Thank you, madam. People will what you say. People will forget what you did, but people will never forget how you made them feel. With this quotation, I want to give a brief introduction about her. Dr. Suresh Lakhana started her nursing career, Bachelor of Art in Economics, Diploma in General Nursing from Irvine Hospital, New Delhi, Post-Basic Nursing from PGI Chandigarh, Master Education and Doctor Education in Curriculum and Instruction, Teachers Columbia University, New York. Her professional experience started with the humble as bedside nurse, classroom teaching at Louisiana, Toronto, many other states of USA. Dr. Suresh is seasoned researcher, so published international many articles in the esteemed Index Journal of India and also published book of historical perspectives of nursing in India and another book, Indian Nursing Leaders from 1947, third edition, almost complete publication. Madam is an international presenter. Many years she was headed the president of TNAI overseas of Canada and USA. She got the life membership of Indian and international nursing organizations, including TNAI, American Nurses Association, Sigma, Thema, Tau. There are lists of achievements on her account. Due to time constraint, I'm not reading all. At the end, we believe coordinated the thought of here. We always gather pebbles at the seashore of knowledge, regardless of age factor. Yes, madam. Speech is the mirror of the mind. We are also eagerly waiting to hear from you regarding your expert views about the topic. With these kind words, I humbly request Dr. Suresh Narulakhanna, please to speak. I am giving assist to you, madam. Thank you very much.
Oh my God, you made me having tears in my eyes.
Thank you so
Greetings
much.
and blessings now from New York, USA, to each one of you, my youngers, my colleagues, and if there are my seniors, which I doubt very much. Okay, coming to the topic right now, I think it is a transcultural concepts in nursing care, and we will be talking about
PPT. Yeah. Okay.
Right from the mother and the founder of this transcultural nursing care. In Leninger's words, transcultural nursing is a substantive area of study and practice focused on comparative culture, caring, values, beliefs, and practices of individuals or groups of similar or different cultures. Leninger's theory, there are differences and similarities in transcultural care knowledge and practices that can be discovered, which will lead to the establishment of modern transcultural nursing knowledge as a guide to nursing practice. According to her, there are three modes of guiding nurses: judgment, where we make our decisions and then make the planning for care, and then we make the interventions or actions. These are the three modes according to her when she started in 1955, and I still see in her models, which is a lunar and that sunrise, whatever model she's used, having all these components in that. These help nurses to provide appropriate, beneficial, and meaningful care, which include preservation, maintenance, accommodation, negotiation, repatterning, and restructuring. Like we will analyze, we will be evaluating, and then we will be making plan for the care. Her model, Sunrise Enabler, was the earliest one, which had these factors. One, technological factors, then religious and philosophical factors, kinship social factors, cultural values, beliefs, and life-based or styles lifestyles, political and legal factors, economic factors, educational factors. These factors influence care practices and care expressions in providing holistic care. The holistic care is, this term is very much in fashion now, in vogue, that we should be taking care of the wholesome person and starting from health, illness, and death on the continuum of that. Then focus on individual, family, group, community, and institutions. And I add to that nations and internationally, because our world is becoming very small. Culture care decisions and actions for congruent care. And this is another terminology used very frequently, congruent care for health and also promotion, wellness, and death. Now, coming to what does transcultural mean? We keep on saying transcultural, we may not have the same meaning in our mind. If we look at the explanation of the word transcultural, it denotes involving more than one culture or means and culturally oriented nursing care. The culturally identified terms refers to how people act as members of different culture and nation or community. Transcultural identity is a source of individual identity that draws from across national boundaries and also from cultural, religious, linguistic, and ethnic backgrounds. There is a difference between multicultural versus transcultural. Multicultural is relating or pertaining to several different cultures, while transculture is extending through the same culture more than one human culture. That assists in providing culturally appropriate nursing care. Let us look at the meaning of concept. We all keep on saying, oh, concepts, concepts. And then we intermingle them with factors, items, and other needs and all. It literally means a general notion in our mind. It is an abstract idea which occurs in the mind. It is a thought or is in our speech. They are thought to be the fundamental building blocks of thoughts and beliefs. These are the entities that exist in mind. It is a synonym of image, thought, perception, theory, view, etc. For example, we give the kangaroo care to the newborn babies. And kangaroo care is the newest, very much utilized I heard from Dr. Usha Malik, who was retired principal from your Indore Choice College, that they are using this kangaroo care, and it is based on the concept of skin-to-skin contact by Jean Watson. Transcultural concepts in nursing care is the key to ensuring safe, ethical, effective care to diverse cultural population. Transcultural nursing is how professional nursing interacts with the concept of culture. It is based in anthropology and in nursing. It is supported by nursing theory, research, and practice. It is a body of knowledge. Now, three questions arises, and we get to this one at a broad spectrum. So each one of us in any nation in gives same kind of standardized, congruent care to the patients. What are a few cultural concepts in nursing care? I remember how we transcultural knowledge through intercollegiate cooperation, which I think Dr. Varghese is doing, and like Dr. and other principals can join and make those standardized care upon the model which I come on later. You have gems and pearls right in your backyard. Benefits of developing a transcultural patient care website. So their patients, relatives, families, nurses, all can look at it, then have a common bond and a common platform to serve the patients. UNESCO, which is United Nations Educational, Scientific, and Cultural Organization, has stated that culture is considered having the fourth pillar of sustainable development. Also, UNESCO mentioned the other three pillars include economic, environmental, and social. The examples of transcultural concepts in nursing care are these. One is customs, architecture, social standards, beliefs, and traditions. All these give you the example of America, United States, that they are empowering all those nations to follow them, their folkways, their all these this dress, bikini, whatever they are using, or their customs or their religious beliefs and the traditions. The transcultural nursing is a distinct nurse specialty which focuses on global culture and culture, health and nursing phenomena. The transcultural nurse looks to respond to the imperative for developing a global perspective within the nursing field in an increasingly globalized world of interdependent and interconnected nations and individuals. The transcultural nurse seeks to provide culturally congruent and competent care to the patient, whether they are in the hospital, in the communities, in the clinics, in the schools, in the out or in private hospitals. Transcultural nurse is prepared to fulfill obligations, role, and duty by providing these following obligations, such as communicating with foreign patients and their loved ones. I have a brief story to share with you. In my second year of nursing training, we, from the embassy at Delhi, Irvine Hospital was there, so from the embassy, the patients or everybody will be coming there. So they brought one lady and we all gasped. We thought she is half naked, but actually she had the stroke. And no, I controlled my emotions, but the orderlies were going to give her stomach wash, and other health workers who were working there were giving all those comments, which were very rude. We talked about it, but 50 years ago, nobody even knew about this culture. And all they thought that she wasn't doing anything. So communicating with patients is very necessary these days when our world is becoming small due to these airplanes and community and other factors. Then educating families on patients' medical status. Then acting as a bridge between a particular patient's culture and practice. Patient's language skills. Then determining if any of the patient's health beliefs relate to the cause, illness, or problem. Then collect information on any remedies the person is taking to treat their symptoms. Like today, I had all concoction, but my daughter and my son, no, you have to have cloves and cardamom, black pepper, so I have my side. So you have to a little bit about their treating ways with the symptoms initially. Understanding the influence of culture, race, ethnicity on the development of social and emotional relationships, child rearing practices and attitudes, and collecting socioeconomic from diverse background data of the patient. Here I would like to mention some current state cultural nursing models and approaches. Dr. Madeline, a founder and mother, which is transcultural nursing, worked tirelessly with others from around the world to expand the of knowledge. Her model called Sunrise, which I have shared with you all, based on care bringing generic folk care, and professional care, and uses 3 actions to provide cultural care. Some of the theorists expanded on this concept. To name a few, I may not go into details because time limit. So you must read. You can Google it and get them. Jiger and David Hizar, Andrews and Boyle, Campion and Biacotti. Campina's model is used extensively in empirical research these days. Then Purnell, Choi, Spector, etc. They try to further and integrate TCN in nursing, education, in practice, in administration, and in research. According to these theorists, the research for future and gaps in knowledge, focusing on increasing diversity of nursing workforce and preventing all health disparities, adding to TCN body of knowledge are like also included in Sagar and Sagas. Now the question arises that how can we transcultural knowledge through intercollegiate collaboration? I just mentioned to you already that these collaborations between the principals, between these suburban areas, between these rural areas where we are sending our students. I hope you're sending your students area also for midwifery observe home deliveries. You can make it generalized care plans for them based upon these models. Then sub-concepts. Generic, folkways care systems. Emic means the multicultural, and professional systems, Attic means the same cultures. Ethnicity or ethnohistory, cultural shock, imposition, sunrise, modern cultural theory, 3 modes of care, I mentioned to you already, then assumptions, analysis, and weaknesses. In essence, Leninger's theory attempts to provide cultural congruent care through cognitively based assistive, supportive, facilitative, or enabling acts or decisions that are mostly tailor-made and that with the individual, groups, or institutions, values, beliefs. This sentence model, I will not go into detail because I have given you already earlier technological factors, and environmental factors. Cross-cutting factors. These are the extent more factors included from the cross cultures. Religion, spirituality, spiritual beliefs and practices, language, styles of communication, verbal and non-verbal. You can non-verbal just show rudeness or amicability, compassion, and politeness. So your non-verbal language is very important. Geographical location, rural, urban regions. We have it in India, all of these. World values, ceremonies, collective, individual. Family, kinship, hierarchy, rules, traditions. Gender roles and sexuality, sexual identity, sexual expressions, gender and norms. Social economy, status, education, resource access, such as healthcare, hospitals, neighborhood, schools, and employment places. Immigration patterns, refugee, seasonal, legal status, migration history, and patterns. And the example is PR, which is a permanent residence visa. Citizen, we are on H1 or we are on visa. So these are immigration patterns. Then cultural identity and degree of acculturation, health perspectives, heritage, history, historical trauma. They did one study, and according to that, Robert Wood Johnson's foundation, they did on 19 nurse scholars. And then the lessons they brought, they eye-opener, and they are still using them at tenured faculty and in the colleges, universities. Then according to this adversity, a key aspect of first century faculty roles as in the Robert Wood Johnson Foundation Nurse Faculty Scholars Program research study of 90 nursing scholars. The lessons learned from this research of 90 scholars are important for the assurance of diversity among faculty. I don't understand the faculty in layman's language, it is like a permanent. First, they are on probation period, then 3 contract or year contract, and then they are put on tenure track. And tenure means permanent. And support nursing education, providing culturally sensitive and nursing research addresses health inequalities. Now, some of the tools of assessment, there are hundreds of tools. This will give you some idea what are the tools used. The Tiger Transcultural Assessment Model has these 6 cultural phenomena: communication, space, social organization, environmental control, and biological variations. If you see with the combing eyes, see whether you touch the ears from the back, from front, they are the same basic things. We have to communicate, we have to have the time and organization, environmental control, and biological variations. These provide a framework for patient assessment and from which cultural sensitive care be given. Normally, the fundamental concepts include health, illness, stress of environment, and of health promotion, which make modern framework. Transcultural concepts in nursing care are included in nurse competent to provide optimum care to the patients while working in education, practice, administration, or research area. Nurses collaborate with medical staff, but not working in isolation, and other disciplines personnel to reach these broad goals or aims to advance cultural competence for nurses worldwide, to enhance the scholarship, substantive knowledge of the discipline, to develop strategies for advocating social change or culturally competent care. It may not be possible to elaborate a tool, but I can mention some names. So you can find it in Google in extension. One, cultural efficacy 2000. It measures the degree of cultural self-efficacy in nursing students. Then heritage assessment tool to assess individuals' culture, spiritual, physical beliefs. Cultural assessment tool, healthcare. Then cultural need assessments tool. Then intervention and evaluation tool. Here I want to spend time. First, I will one sentence introduction. That gem is right here, and she is your principal, Dr. Achama Varghese. She is a hidden gem. She never told me. Only yesterday she mentioned that she has published on this matter, and she developed this model. And I right away went and make a point, read it, and adopt it away. I think if you who are nursing students, those who are faculty, or clinical area, right from tomorrow, should start utilizing this model. You will be surprised. These are all synonymous. Whatever that lecture, 1955, she said it more than 50 years ago. Then this model is a hidden and has very much clarity. At first, right away you know what she meant. Status, human needs. You have heard about Maslow's hierarchy of needs, then environmental, then goals and strengths, and look at beautifully she has that child with thalassemia. But I will go a step ahead. Any disease entity, any cause of problem, the age factor is according to the age, you should be meeting all these plans of care. Then thalassemia child on loading. This is a value system. You have to prepare that, maintaining overall development. That is the biosocial development you have read about in your pediatrics. Then continuing adjustment to internal and external environment. Coping of stress related to freedom, transfusions, medications, investigation. Same thing, I give you example of leukemia patient. Same transfusions, those have IV lines, medications, investigations. All those X-rays and ultrasounds, they are very frightening to the children. Then child maintains quality of life. This is the keyword, QOL, quality of life. The ultimate part is quality of life. You are not or undermining patient when to you in that aspect and in that environment that patient has in and identity. Healthcare systems, they support each, like on left, on right. Right, I will be reading it in a minute. Then need assessment, if you go down, yes or no, then intervention according to these factors. These are the factors I'm going to share with you. First, need to develop disease-specific quality of life, then a scale of thalassemia, and she has beautifully given in two separate entities or items, one for parents and one for the children. Now at the parents, you can have maybe other uncle is taking, auntie is taking care, or just a single parent is taking care. What she put for parents: physical health, parents, financial status, psychological domain, impact of family support, then safety, comfort level, emotional control, then self-satisfaction. And if we go on that other one, it is a little hidden. I will be saying physical self-satisfaction, level of comfort, preparation, and the impact on financial status, peer support. Now, if it is a teenager, there is a lot, then our parents are significant. Then coping mechanism, emotional level, ability to cope with them, motivational factors, inspiration, social factors, and the school factors that at the school. Then academic and spirituality, the sport items or sport factors. So folks, better start working on this gem right there. Coming to the conclusion, transcultural concepts in nursing care help students to transform their things to develop into culturally competent nurses capable of safe, thorough, and ethical care of individuals, families, groups, and communities of diverse backgrounds. Transcultural concepts in nursing care take a lifespan approach to deliver cultural variations in lifestyle habits, beliefs, and life processes. It provides framework that will improve health and nursing care to minorities, underrepresented, disenfranchised, and marginalized populations. The nurses will be able to effectively perform cultural assessments and incorporate their findings into their interventions by using the tools to assess cultural needs. Here, I would like to add, if people are wondering that here in the United States, we have immigration problems, immigrants from multiple countries, Italy, Germany, Philippines, Southeast Asia, India, then Koreans and Hispanics, how we are dealing with that. So there was a need of that. But I see the similarities in India also. Don't we have our classism? casteism, our then regions, our different 17 languages spoken. So I think there are similarities of these, and there is a need of transcultural concepts in nursing care. Coming to the references, I added a lot of them, but there are still some left. You can just Google them. But Andrew Boyle and Campbell's, American Nursing Associations, then McWilliams, Leninger's, Sagar and Sagar, Gonzalo, and our Dr. Achama Varghese also reference is the most important one. I didn't get a time to add it because I just got it very late. Now I'll open it for questions and answers. And thank you, namaskar, greetings and blessings to you all.
Thank you, ma'am.
If there is time, I can go on and on.
They have actually, madam. Hello.
Yes.
Oh, madam, awesome, madam. Thank you, madam, for your enlightening speech regarding the particular topic. Madam, your thoughts really inspired us to dream more, learn more, do more, become more, because it was inspirational, experience-based explanation what you have given in this particular topic. It was interesting and informative. We know how busy you are, but but I am very grateful that you took your very precious time, volunteered to prepare slides and spare your night hours with us. You mentioned 3 modes of judging: judgment, decision, action. And for congruent care, transcultural care is the key to ensure safe, ethical care for our patient. Importance of intercollegiate collaboration is very important pillar to strengthen our knowledge, skill, which is culturally competent. Surely, we will further try to adopt more theories in the patient care. At last but not least, I want to thank you all for attending. Without your presence, which would be never be able to put the webinar like this. Now I want to request the audience, if any query, please, expert is with us. You can ask questions, please. Hello.
Yes, I would like to share one more thing with you. When I came 50 years ago,
Yes, madam.
I used to look down. Always it was in our blood that you should not be seeing eye to eye. It is very rude when you're talking to the seniors. So my first job, first day, my sister, first I called her sister. She said, no, sister, I'm Miss Weisskopf. I said, no, Sister Ji, no, I am Miss Weisskopf. So this was my cultural shock first. And then the other was, she will say, Sue, because long my Suvarash was very difficult for them to pronounce. So they said, Sue, look at me, look at my eyes, let me see. And no matter I will be left and right, up and down. It was very difficult for me to come to the terms to look eye to eye and say the things which I want to say.
Yeah.
Yes, go on.
Hello. Hello. Audience, please. Any question? Even unmute yourself. You can talk to madam very freely, please. Because so many colleges, the dean, principals, the faculty, the students, they all are listening, madam. Hello. They appreciated madam very well, your explanations,
It was
etc.
my pleasure and my honor.
Yeah, thank you, madam, for
bid you all good night.
madam. You have introduced my topic in a nice way. Thank you so much, madam. I never expected.
Oh, you're very welcome. I'm really impressed. If I am there, I would have done it right from tomorrow. That is so standardized model. And when I compared with the factors of Madeline, it was just the same, but in such a appealing grassroots people who can understand. the neophytes how to implement. That is the main thing. We do not know how to implement. We are talking at the upper level, at the research level, and the students are lost, and the new neophyte graduates are lost. So we have to hold their hands and say, this is the model, use it and see how you deal with the intercultural and transcultural concepts.
Yes, yes, madam. Thank you so much, madam.
You are very welcome, and good luck to you with the rest of the day.
Thank you, madam. Thank you. Same to you, madam. We are also praying for the
You are
same.
very welcome.
Yeah, yeah.
We
Thank you,
meet
ma'am.
again.
I'll request Vandana to give vote of thanks. If there is no question, nobody's,
Yes.
yeah,
Maybe they are soaking it yet.
yeah. They have mentioned very
May I?
insightful, etc. Yeah. Yeah, Vandana, go ahead.
Yes, ma'am. Dhanyavad means no duty is more urgent than that of returning thanks. Culture is an ideas, customs, and social behavior of particular people or society. But in our nursing, culture is for caring values, beliefs, and practice of individuals or groups. When the nursing care is interact with the concept of culture, then that patient is going to get a congruent or competent care in the hospital. And ma'am has taught us in a great way. It gives me an immense pleasure to deliver our gratitude to our eminent chief guest, Dr. Subhash Khanna, one who made this event splendid and marvelous. Thank you so much, ma'am. No matter is a day or night, he will struggle for us. No matter they are teachers or students, he will support us. No matter he is a good student or bad student, he will encourage them for their bright future. I would like to extend my sincere thanks to our director, sir, Mr. Mukesh Giri Goswami, who is always supporting each and everyone with a lot of patience and smile. Thank you, sir. Any problem, any situation, even it might be an earthquake, she will be there for us. She resembles a candle because a good teacher is like a candle. It consumes itself to light the life of student. It gives me an absolute pleasure to deliver my vote of thanks to our beloved principal, Dr. Achama Bagis ma'am. Thank you, ma'am. Without teachers, life would have no class. I would like to say principals, teachers, and students from other institutions. Thanks a lot. They are all like energy boosters in our institution. They doesn't have the word no in their dictionary to solve the problems because they always be there for motivate and encourage the students. I would like to extend my sincere thanks to all our faculties. Thank you. Thanks a lot, ma'am or sir. Last but not the least, any order, any task, it will be followed and completed by them. I would like to deliver my thanks to our sweet students. Thank you all, and thanks a lot for this wonderful golden opportunity to make this event beautiful. Thank you. Thanks a lot. Jai Hind.
Jai Hind.
Thank you, madam.
Thank you, ma'am.
Namaste.
Thank you.
Thank you, ma'am.
Thank you, madam. Thank you. Good night, madam. Now,
Good night. I
yeah,
bid you bye.
yeah. Thank you so much. Thank you so much.
And
Thank you. Thank you to all.
Thank you, ma'am.
Thank you. Now we can leave.
Yes, ma'am.
Okay.
Thank you, ma'am.
रितेश, वो जो इनके नाम ये सारे है ना, नाम ले लेना, इनको है ना सर्टिफिकेट देना पड़ेगा। ये एड्रेसेस जूम, ये चार्ट जो किया है ना,
Yes, ma'am.
चार्ट किए हैं इन लोगों ने ना, इनके एड्रेसेस नहीं लिखे। They have now mentioned their okay. Thank you so much. ये सेव कर लेना, name of the attendees है ना। Thank you, Ritesh. Thank you.
Thank you, ma'am.
Thank you so much. Thank you so much.
Thank you, ma'am.
Thank you, Vandana, and all teachers and students. Once again, thank you to all.